Good evening to the committee. It's been a very long day for you all. Yeah, my name is Hugh Blumenfeld. I'm a family physician and I've practiced in Hartford for the past 10 years. I'm also a member of the group that's called Doctors for Cannabis Regulation. It's a national group of physicians and other healthcare providers, but it includes among its leadership, Dr. Wesley Clark, the former director of the Center for Substance Abuse Treatment at the Department of Health and Human Services, and Dr. Jocelyn Elders, who is a former U.S. Surgeon General. You've heard a lot of testimony this evening about the legal and commercial aspects of the legislation. I figured I should speak more about the medical aspects and the impact of marijuana legislation on the lives of my patients. As a family physician, I'm charged with guarding the health and well-being of individual patients, but also the community at large. I not only prescribe medications, but I provide vaccinations and screenings that promote public health and participate in programs that promote literacy, improve the availability of healthy foods, and reduce gun violence. So why would I want to legalize what is widely perceived as a dangerous drug? Well, I don't presume to speak for any doctors other than myself, but I would like to explain some reasons why supporting the legalization of cannabis makes sense to so many of us. First of all, and again, you've heard so much testimony today, I don't want to repeat too much, but from my perspective, cannabis is far less dangerous than alcohol and tobacco, both of which are legal. Together, those two drugs kill over 500,000 Americans a year. As far as I know, the numbers of people that are killed by cannabis, depending on how you count, runs in the triple digits at most. And it's virtually impossible to overdose on cannabis. Again, we're talking about use of these drugs among adults. I personally don't use cannabis, and I never advise anybody to use any drugs recreationally. I think drugs and medications are a gift from nature and from technology and really to be respected. But there's a lot of legitimate reasons for adults to use marijuana. And if these other drugs are legal, then certainly cannabis should have at least the same status. Cannabis, unlike alcohol and tobacco, actually has a long history of use medicinally. The use of cannabis medicinally goes back over 4,000 years. And as recently as 1942, it was listed in the US Pharmacopoeia that doctors used as a list of medications that were valuable for them to use. And if anything, the evidence for its therapeutic uses has only increased since then as we understand more and more about the endocannabinoid system in humans. The second thing is that prohibition of cannabis has just simply not worked. The legislation to limit cannabis use legally started in the early part of this century. There was the Marijuana Tax Act of 1937, which taxed doctors who actually prescribed it for their patients. And then in 1970, it was scheduled as a Schedule I drug. Again, Schedule I is supposed to be for drugs that have no medicinal value, and yet there's copious evidence of the fact that that's not true. So I know that a number of legislators earlier expressed concerns that they were going to be going against federal legislation by endorsing this kind of legislation. But really, the federal legislation that classifies it the way it is, I don't think really stands up. And finally, the use of making cannabis illegal really affects the people trying to use it medically.
I would just alert you your 3 minutes up, so if you could summarize.
Right. So for many reasons, and especially for patients who need to use it medically, the fact that it's illegal for the rest of the population puts a stigma on it, makes it much harder to get. And the illegal supply of marijuana is so dangerous that a lot of patients who would benefit from its more casual use, it's too dangerous for them to use.
Thank you very, very much for joining us. Representative O'Day.
Thank you very much, Mr. Chairman. And Doctor, thank you very much for your testimony. I do greatly appreciate it and giving me another perspective from a physician on the benefits of it. I apologize, I'm driving, but I'm careful. My eyes are on the road. I'm using hands-free. So, Doctor, what type of doctor are you and where do you work?
I'm a family physician and I work in Hartford, in downtown Hartford, as part of a larger practice. By the way, as a family physician, I see patients inpatient at the hospital. I'm a hospitalist. I have my own panel of patients, outpatient. I do deliveries, I do obstetrics. I'm a medical director of a hospice program locally, and I also, part of my work is in pain management and pediatric care. So my practice spans the gamut.
Thank you, Doctor. I'm the son of a surgeon, and so you have my utmost respect and appreciation for your service. When you say that the marijuana has been used medically for thousands of years, would you agree with the other doctors that have testified that the marijuana today is not our grandmothers, grandfathers, or the Native Americans' marijuana? Is that fair to say?
That's very fair to say. And to my mind, it's one of the reasons why it would be much safer for people if it was regulated.
And have you followed what's going on in Colorado with regard to the THC and the issues with the high concentration rates, because they're unregulated with regard to THC rates?
The actual rate may be unregulated in terms, there may not be limits on it, but what's in any given cannabis product is highly regulated in terms of the content has to be specified on the package. So you know exactly what you're getting. The THC and CBD ratios are given on the labels. The product has no pesticides, herbicides, or toxins in it that could be damaging to people's health, and they have they're not adulterated with cocaine and PCP and fentanyl like many of the samples of marijuana around here are. So I understand your concern that the stuff around is very potent, but again, it's not stopping people from using it. It's not stopping teens from having availability of it. And I think that the best way of protecting everybody is to make sure that whatever's in it is well known, so it can be used with education.
Fair enough. And my concern is teen use increasing with legalization. I really don't have much of a concern, frankly, as somewhat of a Republican/libertarian when it comes to this subject. My concern is teen use. So would you disagree with my understanding, and I know there's some disagreement, but do you believe that legalization leads to increased teen use if not properly educated or prevented, like kind of tobacco?
Well, I think the second half of what you said is exactly the point. Without rolling this out in the proper way, there could be some adverse effects. But I think if you look at the idea of rolling out a regulation and legalization of cannabis products that are only for adults, that can only be gotten through registered dispensaries and stores, you'll find that teen use actually, again, the evidence is, I've seen evidence of both sides, and that fact makes me think that it's probably somewhere in the middle. But with the right rollout, you can actually decrease the use among teens. We've seen that with alcohol. We've seen that with cigarettes. We make it much more difficult for people to get these products, and also we stop teens from getting it from drug dealers. And if a teen's going to get it, they're going to figure out a way to get it. We're going to make it as highly regulated and difficult as possible. But right now, people are going to illegal venues to get it, and the same people that are selling marijuana are selling PCP, and they're selling fentanyl, and they're selling things that are laced with these things. I think generally, I myself have teens as well, and I'm very, very concerned about the quality of whatever's out there that they might get their hands on.
So, Doctor, would you be surprised, and I know there's arguments on both sides, would you be surprised that actually the black market, studies that show that the black market has actually increased in Colorado upon legalization, not decreased, because teens obviously can't buy it at the state stores or where they're licensed. Mm-hmm. They have to go to the black market to buy it, and there's actually been an increase in the black market. Have you heard any of that, or does that concern you at all?
I don't have any information about that. I'm concerned about the safety of the people who. I'm concerned with education, and again, my one issue with the bill as it stands now is I would like for there to be a stipulation that a certain amount of the tax revenue from the cannabis products goes to education, goes to rehabilitation services, and goes to support behavioral health generally. I think with the proper education, again, you can reduce teenage use. Obviously, we're all worried about what teens are able to get their hands on. And I don't know that the legalization of cannabis products in those states directly is leading to an increase in the black market. Certainly the black market is going to exist for them. But the idea that they could get their hands on stuff that, more easily on products that's regulated just makes more sense to me. Look, 80 to 90% of teens at this point say that you have easy access to marijuana if they want it. And nothing has changed in the last 50 years since the 1970 when it was scheduled like that.
So, well, Doctor, look, I appreciate very much your testimony, and it does give me some comfort that a doctor at least has some is pro legalization, and maybe I'm hopefully I'm wrong in my belief that if we legalize it and kids see their parents smoking and using marijuana, they're going to think it's okay, and that's how I foresee teen use increasing. But hopefully, if this bill does go forward and they listen to you and more money is spent on education and prevention for youth use, I'll be proven wrong if this bill passes. And Doctor, I do truly appreciate your testimony here tonight, and thank you very much. And Mr. Chairman, I did pull over for the record, put my blinkers on, and I'm going to go get back home. But I'm going to continue listening for the rest of the night. Thank you, Doctor, very much.
Thank you. I just want to say that my kids watch me drinking wine and some alcohol products, occasionally, all the time. And what it shows them is that it's okay, but it's also, done in a responsible manner. Alcohol, in my experience as a doctor, there's nothing worse than end-stage liver disease from alcohol poisoning. And there's nothing more scary than alcohol withdrawal syndrome and trying to treat that in patients. These are two of the most deadly things that I've seen.
Thank you, Doctor.
Thank you, Representative O'Day, and we heard your signal, so we know what you say is accurate. Representative Palm.
You're on mute.
Representative, you're on mute.
Hi, I'm sorry. Doctor, good evening. Your testimony is fascinating to me, and I think you're probably an outlier in some ways among your profession. Would you say that you consider this substance to have the sort of mix of salubrious effects and deleterious that so many pharmaceutical, like antibiotics, which if they're given indiscriminately can, cause gut flora to get out of whack and whatnot. Do you see legalization of this substance as in that same realm where there are benefits to it, but if in the wrong hands or in the wrong doses can lead to harm?
Well, first of all, I don't think I'm an outlier in my profession. I was saying that this organization I'm part of includes some pretty high-powered people, and recent surveys show that a third of doctors believe it should be totally legal, and another third of doctors say it should at least be legal for medicinal purposes. But yeah, marijuana is a powerful drug. What's interesting about it therapeutically is that there's receptors for marijuana in the central nervous system, and there's a bunch of receptors for marijuana in the immune system. And these account for the fact that medicinally, marijuana is very useful for a lot of neurological conditions, like the ones that are legal under Connecticut law, things like Parkinson's disease or ALS or lupus. And then inflammatory diseases like lupus and Parkinson's disease. I have seen the benefits of marijuana in my practice. The Connecticut law is written so that whoever certifies a patient is supposed to have a bona fide relationship with them. And that was meant so that doctors who take care of patients and who know them should be the ones to certify them and say if it's appropriate. And so I took it upon myself that this means that I should, it's kind of my responsibility to do it if it's legal, because I don't want my patients to have to go spend $300 for a marijuana doc and then another $150 for their follow-up appointment just to follow the letter of the law, not the spirit. The fact that it's so powerful is I think one of the reasons why I'm called on to try to help people use it responsibly. Right now, people are using it, hodgepodge. The patients that want to use it medically, I can help them use it, but there's a whole slew of people that use it, I would say medicinally. They use it for relaxation. They use it for sleep. They use it for, chronic pains. And they're the ones that have no access to safe marijuana. And marijuana, when used responsibly, I think is much safer than opiates. It's much safer than NSAIDs like ibuprofen. Some, a number of other people have mentioned how ibuprofen causes a lot of kidney disease. And I've seen it here. I've seen it in the hospital care. People come in with renal failure all the time, and it's because they use NSAIDs. And then Tylenol, one of the most commonly overdosed drugs is Tylenol, and leads to liver failure. Again, all these drugs I think need to be respected. But the
well,
more
thank you, and thank you. And by the way, I wasn't in saying an outlier. That wasn't a trick question. I was just trying to say that we've heard from some medical folks who have been opposed, and it's refreshing to hear to me from a doctor who has the full an understanding of the panoply of substances. And I also appreciated what you said about alcohol disease. I have a lot of alcoholism in my family, and I've seen the devastation, and I appreciate your bringing that up, because I do think there is a certain level of denial about this other substance that we accept so readily and regulate, and in which many of us imbibe, but we don't really want to talk about drunk driving or liver disease or the devastation that can bring, including mental disorders. So thank you for bringing that up, and that was really all I wanted to say. Appreciate it. Thank you, Mr. Chair.
Thank you, Representative. Representative Fishbein.
Thank you, Mr. Chairman. Good evening, sir. You were just talking about other individuals that are not eligible for medical marijuana that you would see having a benefit medically from this product. Is that fair to say? You gave the example of going to sleep.
Yeah, no, I just have to be careful, because there's some things that there's medical evidence that marijuana is very good for. But there's a broad number of people who, whether there's evidence or not, they use it and they say that they have benefit. Now, there may be medications that would do things just as well and possibly safer. And I often will counsel people, and even in the cases where I do certify people for medical marijuana for totally legitimate and medically proven cases, I try to make a point of making it part of a larger medical management of their condition, and not just you can depend on marijuana for curing this condition. But whether we like it or not, people are using it that way, and I just think it's anecdotally they say they get a lot of relief.
Yeah, no, understood. I get frustrated with people are doing it anyway, so we're just going to legalize it because people are doing cocaine too. I mean, I haven't heard anybody advocating for legalization of that, but
I think they just did that in Washington State, didn't they? Or Oregon?
We're here in Connecticut.
Yeah.
So a different issue and perhaps for a different day. But if that's what you see as a benefit, then why not just advocate for an expansion of the medical marijuana program to those individuals? Why, as a professional, do you see going to the nth here?
Well, for two reasons. Like I said, one reason is that people use marijuana for all kinds of reasons, for relaxation, for socialization, for the same reasons they use alcohol. And it's not necessarily medicinal, but it's in some ways therapeutic. Whether we keep it illegal or not, people are going to continue to do that, and it's part of it's cultural and part of it's just societal. It's where we are. But the fact that people can relax with alcohol, which is so deadly, but can't relax with marijuana, just doesn't make sense to me as a physician. Again, I take care of the effects of people smoking all the time. I take care of the effects of people doing alcohol all the time. Marijuana, if it's used in ways that don't make sense, it can cause serious side effects, but it doesn't kill people the way these other drugs do, and it doesn't cause social violence, and it doesn't cause car accidents at the same levels that these other drugs do.
When you care to characterize social violence, because certainly I'm aware of marijuana transactions that have gone bad, that have ended up in people dying.
Yeah.
So what social violence do you claim that marijuana is not part of?
Oh, so, people who smoke don't generally get into fights, bar fights, that kind of thing. People who smoke marijuana generally don't, it doesn't lead to domestic abuse in the ways that alcohol does. People who smoke marijuana generally don't have those behaviors.
And then the last thing was, are you able to prescribe marijuana?
No, I'm not. The way Connecticut law is set up for doctors is there's at this point, there's 30 conditions that are recognized as either proven or likely proven to be beneficial, to be benefited by the use of marijuana products, or cannabis products, I should say. And all I have to do as its physician is to certify that they have one of those conditions and therefore qualify to use cannabis products under the law. So in my practice, in almost all those conditions, at least until 2020, there was actual physical evidence for those conditions, things like Parkinson's disease, things like ALS, things like lupus, things that you could document. PTSD was for a while, was the one condition that you don't really have objective proof for, but it was advocated because I think a lot of veterans were advocating for the ability to use cannabis products for PTSD.
I'm sorry, I didn't want to.
Yeah, so just to sum up, I generally don't diagnose the patients and then certify them. I count on a professional in the field to give them a diagnosis. And then if they have the diagnosis, I certify them so that they can get a card from the Department of Consumer Protection.
So somebody else, some other doctor makes the determination that the individual would benefit from that product, and then they send them to you?
No, they make the determination that the patient has the condition that Connecticut law says your ability to use it. I kind of, with the patient, I try to make sure that marijuana would be appropriate for them. I've had some patients that I didn't think marijuana is appropriate for. And for instance, if I have a patient who's being seen by a psychiatrist or a neurologist, I always consult with that specialist before I certify them for the marijuana. My job is to see that they have the certifying condition and also make sure it's appropriate for them specifically.
But
in
your practice, someone else makes that determination whether or not they have the certifying condition.
Well, like I say, usually I recommend, almost all the conditions have objective evidence that go along with them.
Sure.
And for the couple that don't, I do rely on somebody else to make the diagnosis so that I'm not in the position of saying, oh yes, you have this disease, and oh yes, you can have a card.
Okay, and then isn't it true that you can't issue a prescription for marijuana because it's illegal under federal law?
Correct.
Okay, well, I just, because at the beginning of your presentation, you had said something that you didn't agree with the federal law or something like that. I didn't.
Oh, well, the federal law is really interesting because, it started out as a tax on doctors who prescribe marijuana, cannabis products. And as I said, up until 1942, cannabis products were on the US pharmacopoeia of things that doctors could legitimately use for their patients. It's not like cannabis has always been considered an illegal, very dangerous drug. The dangers of its use, it's interesting that all this happened after we had this whole debacle with prohibition of alcohol. It looks like the government may have just switched its attention to something else, a lot more marijuana, and maybe in response to prohibition of alcohol, more marijuana was coming up from the south of the border. That's when it started being called marijuana. It was in the 1930s. It was part of the campaign to make it illegal. Before that, everybody knew it as cannabis. Calling it marijuana, and one of the reasons I don't use that term is because it stigmatizes it and it gives it associates it frankly with people migrating from Mexico and from other parts of Latin America.
I'm just trying to link up what you said at the beginning with that you didn't understand that it was illegal under federal law, or you had referenced the discussion earlier. And I'm just trying
it seems like a lot of the representatives were nervous or concerned that by making cannabis products legal, that they would be going against federal law. And the federal law from 1970 scheduled marijuana and cannabis as Schedule I substances, when in fact they're really not, because it's always been acknowledged that they have medicinal use. So that's a part of the federal law that I think.
Under what? Because I checked as of last night, marijuana is on Schedule 1 of the controlled substance schedule.
Right.
So you're saying that it's not?
No, I'm saying that I'm not sure that it should be.
Well, that's a different issue.
But that's what I was trying to say.
But that's not an issue.
But the definition of Schedule 1 is supposed to be, drugs that have no accepted medicinal use. And that's never really been true about marijuana.
No, well, evidently our legislators in Congress, I guess, think so, because I mean, we've got representatives in Connecticut, we've got 2 senators, we've got 5 Congress people. I don't think any of them have put in a bill to make this legal under federal law, or to take it off of Schedule 1. And while I may agree with you, it's still illegal under federal law. So anyway, okay.
Yeah.
Thank you, Mr. Chairman.
Thank you, Representative. Other comments or questions from other members of the committee? Seeing none, thank you very much for spending a portion of your evening with us.
Well,
Hope you have a good rest of the week.